The global rise in non-communicable diseases, NCDs, such as obesity, type 2 diabetes, and cardiovascular diseases is a growing public health concern. Countries across the globe are battling the significant impact of these conditions on their population as well as economic health. Ghana is not exempt. Located on the west coast of Africa, the Republic of Ghana has a population of about 34 million people, majority of whom live in urban areas where the food environments are rapidly changing, from minimally processed homemade foods to ultra-processed products. The timing, frequency, form and amount of food consumed are also changing due to time constraints and busy schedules. Despite efforts by government and stakeholders in the health sector to protect, promote, provide and assure good health and well-being, Ghana continues to experience a surge in non-communicable diseases amidst food insecurity, micronutrient malnutrition, and infectious morbidities. About 12% of Ghanaians are food insecure, 49% of children under 5 years of age are anemic, 50% of Ghanaian women aged 20 to 49 are obese, and some 51% of Ghanaian pregnant women are anemic, according to the most recent demographic and health survey. According to the World Health Organization, non-communicable diseases (NCDs) are the #1 cause of death and disability worldwide, accounting for 74% of all deaths. In Ghana, NCDs are responsible for 1/3 of all adult deaths.
And although we do know genetics plays a role, the reasons or determinants of the non-communicable diseases we are battling with currently have a lot to do with what we eat or what we do not eat. And so diet. Talking about diet, that which research has shown to be a key determinant here has to do with consumption of energy-dense but nutrient-poor food. So energy-dense, for example, food that can give you a lot of energy, so sugars, lipid or fats, but also proteins. And so our overconsumption of these would lead to intake of a lot of energy that the body would use some, the rest are then stored, and those stored energies are those that are causing problems.
The other problem that we are experiencing currently has to do with sugar-sweetened beverages. And we have argued that if action is not taken, sugar-sweetened beverages would become the next tobacco.
Research has consistently shown a significant link between the consumption of health-harming food products such as those with high amounts of trans fatty acids, sodium, and sugar and NCDs.
The common misconception about processed food or these sugar-sweetened beverages and non-communicable diseases is that some people regard this as non-food, and because it has very high calories, so it contributes to the caloric load of the individual, yet they do not regard it. They will mention to you the porridge or the tea that they took in the morning, they will mention the kinky they took in the afternoon, they will mention the rice they took in the evening, yet maybe the soft drink they took during the midday, they don't regard them as food. And these are the hidden foods that are really contributing to the caloric load and also influencing the weight gain of individuals.
In particular, the consumption of sugar-sweetened beverages, SSBs, has been identified as a significant risk factor for obesity, diabetes, dental caries, and other diet-related NCDs.
When you eat food that is high in sugar, it is absorbed into the blood, and once you are not able to make use of it, it is converted to fat and gets stored, and it leads to weight gain, increased hypertension, diabetes, dyslipidemia, or any heart-related condition. Weight gain is a major risk factor for most of the non-communicable diseases.
Despite the staggering number of deaths and complications, it appears taste and convenience continue to stand in the way of efforts by stakeholders in preventing and controlling the prevalence of non-communicable diseases.
No, I never want to grab Mohammed because right now I never want to grab it's not the fixed price in any baby have a Kobiano, be our Boamoton. So normally no, it's not about the price, but I like it. When I drink it, it makes me
When it comes to consumer behavior, I mean, the theory has actually, suggested that people don't always buy based on logical reasons. Hedonic theory actually suggests that people actually make consumption purchases based on a lot of emotional connections. They seek pleasure in what they buy. And so, to the risk of their own personal health, they keep buying these things because they have actually lost control. So when you take sugar-sweetened beverages, for example, although it gives them, issues, health conditions, diabetes, etc., they still keep on buying it. Even when the prices are high, they still keep on buying it because they've developed a certain loyalty towards them over time when they have consumed, seeking to, satisfy these pleasures. But of course, they come at a price individually, as I mentioned. They have to now spend a lot of money towards their health needs. But then also the public health, budgets, we tend to have to spend a lot of money towards, public health, conditions, for example. So we have to find a creative ways, very robust ways to help people take control, of their own, consumptions, especially hedonic consumptions, so that we could actually reduce the impact on our health, but crucially also on public health, budgets, etc. And I think that when we do that, we could see results, and we could actually improve our personal health and our public health conditions.
What I know is that when it's good to take in, but not too much. When you overtake it, or like when you always take it, it have effects on you. Sometimes it can increase your sugar level.
Be that as it may, available data suggests that the forces at play extend beyond personal choices and the willpower of consumers.
For some time now, maybe 30, 20 years ago, we had researchers who are interested in generating evidence and hoping that their evidence would influence what practice and policy. It is important for researchers from the time they are conceiving of their research to engage all the relevant actors who would be using their evidence, and not only policymakers but also practitioners, knowing that evidence alone is not enough to instigate policy. We had to work with civil society organizations who are very good at advocating. And so these coalition of academics and civil society organizations, we then generated the evidence. Evidence generated and applied elsewhere show that if we intervene at the macro level, say at our food environment level, is more impactful than at the individual level. So our motivation for the project was that if other countries have done this and there are evaluations that show that these interventions are impactful, why shouldn't Ghana be interested? But aware of the multiple, sometimes competing, demands, we needed to create a favorable environment for the policies, but also political buy-in. So we formed the Advocating for Ghana's Health Coalition, comprising a number of academics from most of the universities in Ghana, but also civil society organizations whose work relate directly or indirectly, to health. And the coalition is currently working towards creating that favorable environment, an environment where the Ghanaian government and other food systems actors see the need for food-based policies to be developed and implemented.
Here at the University of Ghana lies a successful collaboration led by the School of Public Health and civil society organizations, Ghana NCD Alliance, Ghana Public Health Association, Ghana Academy of Nutrition and Dietetics, and the Coalition of Actors for Public Health Advocacy, who use evidence-informed advocacy and scholar activism to support the enactment of SSBs tax in Ghana.
So academia, we have two main roles that we play as far as the issue of NCDs and generally health is concerned. The first one is research. So we are involved in generating both the primary research to understand these diseases, but also the research that enables us to develop solutions to it. So this is what we call implementation science. And then we are also involved in training the next generation of those who are working as practitioners to prevent these conditions, to treat them, but also to generate the capacity to advocate for addressing these from a political perspective, looking at it from how do you implement it appropriately within health systems, within social systems. So there's a whole ecosystem of things that our research and our training does. So from my department's point of view, one of the key research is to generate the kind of evidence that shows the scale of the problem.
It was very key for us to assess the general population's level of awareness or understanding of non-communicable diseases. And to do this, we decided to conduct a nationwide survey to be able to generate local evidence to use to support our advocacy or sensitization activities. And so findings from this survey show that Ghanaians were very much concerned about non-communicable diseases, and especially among children.
One of the major interventions that has proven to work to reduce the extent to which people are exposed to sugar-sweetened beverages is through taxation. Indeed, taxes sometimes are very nuisance, increase economic hardship. But when it comes to taxes on unhealthy commodities, these taxes are called excise taxes. They are called health promotional taxes.
Wherever we went as a group, being it parliament or whatever, the question came up that what is the evidence? What evidence do we have that just fiscal policies will help address these things? What evidence do we have that we are having a high surge in NCDs, or we are having issues that these fiscal policies will address? So evidence generation is one very key aspect of it. The other aspect has to do with building the momentum, which will require different actors being able to establish well your key stakeholders that can drive the change that you need.
So specifically we asked Ghanaians that would this support the implementation of a tax on a sugar-sweetened beverage or beverages, and 2 out of 3 Ghanaians said yes, they were going to support a policy like this. And their level of support increased when they got to know that the revenue generated from these taxes will be used to support public health interventions.
When you look at the sugar-sweetened beverages, we were already taxing carbonated drinks, which actually also contained some sugar. And so this new tax policy came in to augment. When you look at the rationale for the tax, is to discourage consumption of sugar-sweetened beverages. That is the main reason. And then, of course, we have some side effects which will include the revenue generation. After the first phase of the implementation of the policy, if there will be any need for redesigning the tax, which will actually be based on sugar content. Here, we are not only looking at the consumer buying less because of the price, but we're also looking at the industry also reducing the sugar content in the product because the tax is actually hinged on the sugar content.
First of all, the purpose of having a tax on unhealthy food is to make it expensive, to reduce consumption, to raise revenue for government to do health activities, and also to reduce the risk for NCDs. It's true that the rich can still afford it anyway, but the poor, who are the majority, are those who are unable to buy because it's expensive. And the good news is that these are the people who don't have the money to pay for the hospital bills, who don't have the money to be able to fly out of the country and get medical care. And so if the tax will make the thing so expensive, even for the poor, then our goal is achieved. Because if it's become very expensive and the poor cannot buy, then indeed the consumption will reduce, the risk for getting NCDs will also reduce.
Sugar-sweetened beverage tax has been introduced in over 80 countries globally, and quite a lot of best examples that have come up are those that have come up from Mexico and South Africa and many other countries that lines our own African states, looking at its impact on reducing consumption of these beverages, helping address issues of the surging rise in non-communicable diseases over the globe. Other important things that have come up through some of these global evidences have been evident in some industries trying to reformulate their product in providing healthier options for people. And so these basically have been some of the gains in the global policy on sugar-sweetened beverages. Of course, we can also talk about the aspect of revenue and revenue generation for states and its use also in resolving other essential priorities of governments.
The civil society organizations who are part of the coalition have the mandate to mobilize but also sensitize the Ghanaian populace as to why these policies are important, but also what actions they can take to demand of the government to do what governments do, protect their citizens, including ensuring that their public health needs are met.
So as part of the sensitization activities, we organized a number of webinars where we sensitized public health associates, medical practitioners, students, nutritionists, dietitians, and these webinars provided a platform for interactive discussions, knowledge sharing, addressing some misconceptions about sugar-sweetened beverages, and even non-communicable diseases as well. We also organized mass floats targeting the northern sector of Ghana, the middle belt, the southern part of Ghana, and also the eastern part. We also organized public lectures.
Journalists have received, I think, 2 rounds of sensitization, but also capacity building, such that these messages or evidence we are generating are communicated to the Ghanaian population in ways that they would, understand.
We are currently also working very closely with government to come up with additional policies on labeling of foods, nutrient profiling, marketing of unhealthy foods, and then procurement of food that is supplied through government systems.
What are governments supposed to do? As far as we're concerned, of course, there are a number of them. One, to promote, to protect, and assure the health of their citizens.
We are your representatives, and we are ready to serve the best interest of the country. You have given us this statement. We will present the statement to the committee. We will look at it, and if possible, we will give you the opportunity to appear before the committee, give us your data or your evidence supporting your position. I hope you are also not oblivious of the fact that it's the FDA that controls that particular sector, and so we'll also give them the opportunity to appear before us, and we will listen to them. Of course, we will also give the opportunity to the industry players, so that we'll also listen their side of the story, and we will always be for the best interest of the country. So you are warmly welcome, and we thank you for this endeavor. Thank you very much.
Industry interference has been reported to be a challenge to the fight globally, and Ghana is not exempted.
In some of these countries that I've cited that had been able to implement that, it didn't come without a struggle. They had a lot of industrial interferences, even some taken to court on the validity of they implementing some of these evidence that have been shown.
I remember one of the instances where there was a TV interview between me and one of the marketers of these beverages, and it got so wild and got so personal. And of course his point was that why are we destroying their businesses? We are also to bring to bear what the effects of their drinks are doing to people's health. I work in a dialysis unit. I see people who come with diabetes, hypertension, and got kidney disease from that. I see the impact that it's making on their lives in terms of spending all their money on dialysis fee, which some of them pay more than 1,500 cedis in a week, by the number of months, how many days they are spending their money in the hospital. How people who were very strong and working, getting able to fund for their families, have now become bedridden, cannot go out again. I see the impact of this. So when it comes to the industry, we are ready to meet them with what people are going through and to speak to their conscience, because in other countries, industry responded to the call and changed their product to make it more healthy. So that industry interference always is there, but we also make sure that we bring the facts out, get Ghanaians to understand what we are saying, so that they can also make the right health choices.
If maybe we have the education a bit earlier, we wouldn't have been here. But it's very scary. One, kidney failure or end-stage kidney failure is a silent killer. Very silent killer. You wouldn't even know when it's about to take you away. Because normally it starts from stage 1, stage 2, stage 3, stage 4, stage 5. Within the stage 1, 2, 3, and 4, you will not even know. And by the time you realize you are at the end stage and you need to come on the dialysis machine, and it's very expensive too. Very, very expensive.
So we are mounting a multi-pronged, intervention, not only just generating the evidence, but also communicating same, not to researchers alone, but to diverse population groupings in the country.
Brother, there's a saying I can, and to when it hits you and you are there you get to know that, hey, what people were saying, if I could have taken that advice, it could have helped me. If we heard last year, our unit was closed down, all because we didn't have the consumables. Now that you are strong, you are able to go and come, please manage your sugar intake, if you can stay away from it at all.
Spread the word about NCDs in your community, schools, and workplaces. Educate others about the risks associated with unhealthy diets and lifestyles and encourage them to act. Efforts by governments, educational institutions, and civil society organizations, as well as efforts by individuals, are required if we are serious about mounting a meaningful response to reducing NCDs in Ghana. Join hands with the Advocating for Health Coalition to advocate for healthier diets, healthier lives, and Ghana's health.